Today's top stories. Microbiome leak from mouth to gut can flag GI cancer. Key clinical challenges in diverticulitis. New ACG guideline. EULAR project reveals gaps in European rheumatology care. Dual-targeted therapy may be beneficial in refractory PSA. Chemo drug exposure linked to CAR T-cell therapy outcomes. EUS biopsy aids autoimmune pancreatitis diagnosis. Bisphosphonates tied to lower mortality in HR plus breast cancer. AI may know how you'll respond to a vaccine before you get it. This weight loss hormone may protect the liver even without weight loss. And 3 minutes of sprinting does something 90 minutes of exercise does not. We start with microbiome leak from mouth to gut can flag GI cancer. Microbiome leak from mouth to gut can flag GI cancer. TOPLINE oral bacteria colonizing the gut, quantified using a new mouth-to-feces MF transmission index, were significantly more abundant in patients with gastric and colorectal cancer, enabling diagnostic classifiers that outperformed standard fecal occult blood testing, FOBT. The signature was validated across some independent cohorts and remained effective using oral samples alone, pointing to a promising non-invasive alternative to conventional stool-based cancer screening. Methodology. Although oral bacteria are known to colonize the gut in some disease states and have been identified in colorectal tumors, whether oral-to-gut microbial transmission can be quantified in a clinically meaningful way and leveraged for non-invasive gastrointestinal (GI) cancer detection remains unclear. Researchers analyzed paired oral and fecal microbiome samples from 507 participants in South Korea, including healthy control individuals, N equals 129, individuals with metabolic disorders, metabolic syndrome, hypertension, hyperlipidemia, or type 2 diabetes. N equals 215, patients with gastric cancer, N equals 77, and patients with colorectal cancer, N equals 86, to develop a quantitative metric measuring O. Key clinical challenges in diverticulitis. New ACG guideline. New recommendations from the American College of Gastroenterology, ACG, on the management of colonic diverticulitis in the outpatient setting address an array of notable challenges in treating such patients, including discouraging the use of antibiotics and tricky dietary recommendations to prevent recurrence amid a lack of data. Many clinicians struggle to manage these patients, particularly those with recurrent disease, because they feel they have little to offer. First author Ann F. Peary, MD, of the Division of Gastroenterology, University of North Carolina at Chapel Hill, NC, told Medscape Medical News. That frustration can lead to unnecessary or even harmful treatments, she said. We wrote the guideline to help gastroenterologists identify ways to support these patients. The guideline was published in the American Journal of Gastroenterology. In the U.S., colonic diverticulitis, occurring in an estimated 3% of men and 5% of women, accounts for an approximately 1.7 million clinic visits annually, with related healthcare costs reaching an estimated $5.5 billion, the authors reported. In most cases, about 88%, the disease presents as acute uncomplicated divertic. EULAR project reveals gaps in European rheumatology care. A new study published in the Annals of the Rheumatic Diseases highlighted substantial disparities across European countries in terms of access to rheumatologists, treatments, and non-pharmacologic care for rheumatic and musculoskeletal diseases, RMDs. The study analyzed data from 36 member countries of the European Alliance of Associations for Rheumatology, EULAR. The primary objective was to establish a longitudinal baseline for monitoring inequalities and assessing progress toward more equitable care. RMDs are among the leading causes of disability worldwide and account for about 1 in 5 years of life with disability in Europe. However, healthcare responses have historically been uneven, partly because standardized measures for comparing rheumatology resources are lacking. The first edition of the EULAR RheumaFacts project addressed this gap by providing a detailed overview of rheumatology resources and access to care across Europe. RheumaFacts is the first harmonized database to systematically compare healthcare resources, workforce capacity, and access to rheumatology care across European countries. In this first edition, 36 of EULAR's 40 member countries provided data through Dual-targeted therapy may be beneficial in refractory PSA. TOPLINE in a real-world cohort of patients with treatment-refractory psoriatic arthritis, PSA. Combining two advanced targeted therapies was feasible and was associated with improvements in joint and skin measures and patient-reported outcomes. Adverse events were infrequent and mostly mild. Methodology: researchers performed a nested analysis within a prospective PSA cohort at 2 Toronto centers and identified 39 adults who received 2 concurrent biologic or targeted synthetic disease-modifying antirheumatic drugs, B/TS-DMARD, for at least 60 consecutive days. They aimed to describe patterns, effectiveness, and safety of intentional dual B/TS-DMARD therapy. Dual therapy was defined as the concurrent use of 2 agents from these classes: TNF inhibitors, interleukin-17 inhibitors, IL-12/23 inhibitors, IL-23 inhibitors, JAK inhibitors, tyrosine kinase 2, TYK2 inhibitors, or phosphodiesterase 4 inhibitors, apremilast. A total of 24 patients, median age at initiation, 51 years, 45.8% women, who received a biologic plus a JAK or TYK2 inhibitor were included for the effectiveness analysis. Furthermore, 15 patients who received a biologic plus apremilast were included for TH. Chemo drug exposure linked to CAR T-cell therapy outcomes. TOPLINE patients with relapsed refractory large B-cell lymphoma, LBCL, who achieved optimal fludarabine exposure during lymphodepletion chemotherapy had better progression-free survival after chimeric antigen receptor, CAR, T-cell therapy than those who did not achieve optimal exposure. Methodology: researchers conducted a prospective cohort study to assess whether fludarabine exposure during lymphodepletion chemotherapy was associated with CAR T-cell therapy outcomes in patients with LBCL. The final analysis included 54 patients with relapsed refractory LBCL at a Spanish hospital between March 2021 and September 2022. The median age was 59 years, and 56% were men. Patients received manufacturer-recommended lymphodepletion with fludarabine and cyclophosphamide, with dosing that varied by CAR T-cell product, axicabtagene ciloleucel or tisagenlecleucel, followed by infusion after a 3 to 5 day washout period. Fludarabine exposure was measured using up to 7 blood samples collected between the start of lymphodepletion and CAR T-cell infusion, with area under the curve, AUC, from time 0 to last measurable concentration calculated using a population pharmacokinetics model. EUS biopsy aids autoimmune pancreatitis diagnosis. TOPLINE endoscopic ultrasound-guided fine needle biopsy, USFNB, achieved 79% diagnostic accuracy for autoimmune pancreatitis, AIP, and newer Francine and fork-tip needles performed better than older bevel-type needles. The procedure obtained adequate tissue samples in 97% of cases and contributed to definitive diagnosis in 69% of patients when other diagnostic modalities were inconclusive. Methodology: a systematic review and meta-analysis included 16 studies, 1 randomized controlled trial, 4 prospective studies, and 11 retrospective studies, evaluating EUSFNB for tissue sampling in patients with AIP. The analysis encompassed 732 patients, predominantly with type 1 AIP, from studies conducted in Japan, China, South Korea, Italy, the United Kingdom, and Denmark. Researchers assessed diagnostic accuracy, sample adequacy, contribution to AIP diagnosis when other methods were inconclusive, and adverse events associated with the procedure. Various needle types were evaluated, including Francine needles, fork-tip needles, and reverse forward bevel needles of different gauges, 19G, 20G, 22G. Diagnosis of AIP was based on the International Consensus Diagnostic Criteria. Bisphosphonates tied to lower mortality in HR plus breast cancer. TOPLINE bisphosphonate, BP, use for at least 1 year after breast cancer diagnosis was associated with reduced all-cause mortality and breast cancer-specific mortality in women with hormone receptor-positive, HR plus, breast cancer. Among those with triple-negative breast cancer, TNBC, Pre-diagnostic BP use and continued use across both pre- and post-diagnosis periods, on the other hand, were linked to more than tripled recurrence risk and more than doubled breast cancer-specific mortality risk, the new study showed. Methodology, a meta-analysis published in 2015, reported beneficial effects of BPs on breast cancer recurrence, distant recurrence, and mortality, with larger magnitude effects observed among postmenopausal women. According to the authors of the new population-based cohort study, limited data are available on the impact of pre-diagnostic BP use on patient outcomes, and studies on the efficacy of BP therapy across patients with different breast cancer subtypes are limited. The new study was conducted using data from the surveillance, epidemiology, and end results cancer registries in Albuquerque, New Mexico, and Seattle, Washington, enrolling 3696 women, 2260 HR plus cases, and AI may know how you'll respond to a vaccine before you get it. AI may know how you'll respond to a vaccine before you get it. AI may be able to predict how well a vaccine will work for you before you even get the shot. Date: August 21, 2026. Source: Arizona State University. Summary: AI may be able to predict how strongly someone will respond to a vaccine before they receive it. By analyzing antibody patterns in more than 4,000 people, researchers found signs of immune readiness that helped distinguish strong responders from weak ones. Surprisingly, even some healthy people responded poorly, while some immunosuppressed people mounted strong responses. Share: vaccines prevent serious illness for many people, but the immune protection they produce can differ substantially from one person to another. New research led by Arizona State University offers clues about what may be behind those differences. The immune system may show signs of how strongly it will react even before vaccination. Researchers at ASU and collaborating institutions examined blood samples from more than 4,000 people, measuring antibodies that recognized 185 antigens. Those immune targets included common viruses and bacteria, along with targets connected to autoimmune. This weight loss hormone may protect the liver even without weight loss. This weight loss hormone may protect the liver even without weight loss. Date: August 21, 2026. Source: McMaster University. Summary: a hormone already known for curbing appetite and supporting weight loss may have a surprising second job, protecting the liver from inflammation and scarring. Researchers at McMaster University found that GDF-15 activates a previously unknown brain-to-liver pathway that triggers the release of glucocorticoids, helping calm immune activity in the liver. Share: researchers at McMaster University have uncovered an unexpected role for a naturally occurring hormone already known for reducing appetite and supporting weight loss. The hormone appears to protect the liver from inflammation through a previously unknown signaling pathway, a finding that could point toward new approaches for treating advanced fatty liver disease. The study, published in Cell Metabolism on August 10, 2026, found that GDF-15 can reduce liver inflammation and slow the development of liver scarring even when weight loss does not occur. The result challenges the long-held view that the hormone's benefits are primarily tied to its effects on appetite and body weight. A new TA: 3 minutes of sprinting does something 90 minutes of exercise does not. 3 minutes of sprinting does something 90 minutes of exercise does not. Date: August 21, 2026. Source: Rockefeller University. Summary: a few minutes of sprinting may reshape the bloodstream far more dramatically than a much longer moderate workout. 6 30-second sprints altered nearly a quarter of the blood proteins measured and more than 200 metabolites, while 90 minutes of moderate cycling produced far smaller immediate changes. Many of the proteins affected by sprinting were also associated with lower risks of obesity, type 2 diabetes, and other metabolic diseases. Share: just 3 minutes of sprinting may produce a molecular response that looks very different from what happens after 90 minutes of moderate exercise. Researchers at Rockefeller University compared how the body responds to exercise performed at different intensities. They found that 6 30-second, all-out sprints changed nearly 1/4 of the proteins measured in the blood immediately after exercise. By comparison, 90 minutes of continuous moderate cycling altered less than 1/4 of 1%. Moderate treadmill running affected more proteins than cycling, but still far fewer than the brief. That's all for this news briefing. Thanks for listening. Also, don't forget to hit the subscribe button.